Transportational injuries include the car accidents as well as the railway run-over injuries, the pedalists, the motorcyclists, and any vehicles that can be impacted through that are basically included in the transportation kind of injuries. Now, there are special investigations when such an impact occurs. After that, there are special autopsy findings that we have to focus on, and we have to look on. For example, the blood samples are taken for the intoxication states. As they can be specifically the alcohol intoxication states or any drug abuse states that can cause the underlying cause to the transportational injury. So they have to be investigated in detail, and the autopsy report has to be documented in detail as well. The kind of patterns on the pedestrians, they can be again very important, and they are a very important kind of evidence that has to be documented in the autopsy reports as well, because these pattern injuries are going to be conclusive after the whole evidence has been collected. In this section, basically, mainly we are discussing the cause of death. So whenever we are dealing with a road traffic kind of an accident, whatever the case may be, we are basically finding the cause of death of all the people involved in that case. It can be the occupants of the vehicle as well as the pedestrians. All of these are basically included whenever this kind of an accident occurs. Because, of course, it can be of a homicidal nature. The medico-legal aspects basically include the homicidal, the suicidal, as well as the accidental nature. So we have to define what are the proofs towards a certain kind of an investigation. Then the autopsy parameters, what are the specific parameters that has to be fulfilled whenever we are dealing with such a case. That is again very important. What was the environment? How many occupants were there in the vehicle? That is again very important. And how many pedestrians were involved in that accident? That is again very important. What kind of injuries occurred to them? Did they prove fatal or not? That is all documented over there, and that has to be investigated as well. Now, the suicides are again very important, and we have to deal whether this suicide is really a suicide or it is a homicide converted into a suicide. So it's again very important over here. And then the railway injuries. So the railway injuries are usually the run-over injuries, and we'll be discussing the causes and the outcomes of these railway injuries over here, and the type of impacts and their results are again discussed over here. So the cause of death in the traffic accidents is usually the organ damage. So any of the vital organs can be included over here. It can be the brain, it can be the heart, the liver, the kidneys, the spleen, or the all of these special vital organs, they can be included. Even the lungs can be a cause, because they can be a cause of the asphyxiation process. So any compressional injury that is going to result in the damage to the organs, that is going to prove fatal for the people who are involved in that traffic accident. Then severe hemorrhage is one of the cause that will obviously result in the shocked state. So that is again going to prove fatal for the people who are involved in such an accident. Then the blockage of the air passages from the blood. So it's basically, it can be a thrombotic or an embolic kind of an episode, as well as any blockage that can occur to the asphyxia, that can basically block the trachea or the bifurcation of the trachea, or even the compression of the lungs, that is going to result in an asphyxiating state that is going to prove fatal for the person. Then the traumatic asphyxia from fixation of the chest. Again, it is going to prove fatal because the person will be unable to breathe. For example, the traumatic asphyxia that is resulting due to the flail chest or the compound fractures of the ribs is again going to be the cause to these road traffic accidents and the underlying causes behind it. Then the renal failure from the hypotension. So renal failure is one of the leading causes of death over here, and the extensive muscular damage is also one of the causes over here, because the extensive muscular damage will basically result in a proteinemic state, and that will basically put on high load over the kidneys, and that is going to result in the renal shutdown or the renal failure as well. Then the fat embolism is again very important, and after the trauma, the fat is going to be dislodged, and it can cause the embolism in a lot of cases over here. Local infection and systemic infections are again very important over here. And after the initial trauma, If the initial treatment is not given properly, these infections, these subsequent infections can result in the sepsis and the death of the person. So the person can basically go into a septicemic state. The myocardial or the cerebral infarction is again very important. It can be an ischemic state, and the shock can result in the ischemia to the myocardium as well as to the brain, which is going to prove fatal for the person. Natural diseases, of course, if there are some underlying diseases, they can again contribute, for example, diabetes, hypertension, or any heart diseases if the person is suffering from. It can all relate to these traffic accidents. Even any aneurysms, any underlying aneurysms can rupture after the trauma, and that is going to again lead to the cause of death over here in the traffic accidents. Now, talking about the autopsy in the road traffic accidents, what are the samples that we are going to send to the chemical pathologist? Of course, the routine samples, that is the blood, the urine, the pleural fluid, the vomitus, if it can be collected, it is sent to the chemical pathologist for the assays. And the identity of the body, to identify the body, it is very important to get the personal details and the complete history of the person. So the examination of the garments, of course, before removing the garments and before performing the autopsy for the samplings as well as the tissue samplings, we are going to examine the garments in detail. The body samples for blood groupings. So again, it is very important for the personal identification of the victims that we get the blood samples and we send it for the DNA and for the blood sampling as well. DNA fingerprinting is again very important. The degloving phenomena over here after death is again very important, and the DNA fingerprinting is done by that method even sometimes. The blood analysis for alcohol, for any sedatives, or for any carbon monoxide poisoning that can cause the alteration in the consciousness. All of these intoxications are checked for whenever the blood samples are taken, and the hair samples are again taken and they're sent for the chemical pathologist. And the external examination over here is again very important. The complete examination of the clothes is again very important, and the detailed examination of the hair, especially for the DNA sampling, it's again very important over here. The suicide and the homicide by the motor vehicles is again very important. And why does this happen? It's a very rare type. Atypical injuries occur after the suicide and homicide. If it takes place by the suicide, it can be due to an intoxicated phase. For example, the sedatives are taken by the person, self-administered, or someone has given it, depending upon the condition, whether it's a suicide or whether it's a homicide. Documented. Now, the focal depressed fractures of the skull, they occur after this self-impact occurs, and the soot inhalation is again a very common cause of death over here whenever such motor vehicle accidents occur. Alcohol is sometimes the leading cause of death in a lot of countries of the road traffic accidents, as well as the stupefying kind of drugs. And the analysis and the blood analysis is again very important over here. Railway injuries occur in a lot of cases. They are usually of the run-over type and from the electrocution by the overhead cable. So that is basically the main leading cause of death in these railway injuries. The malicious damage to the trains is again very important, and the decapitation, that is basically the head is decapitated and it's no longer a part of the body. So that is basically very common in the railway injuries, and there is local tissue destruction also observed in such railway injuries. And the soiling of the damaged area is again very important, and the soil samples are taken and they are sent to the chemical pathologist. The search for the alcohol and the drugs or any intoxicating state or any evidence to such intoxications is done for the evidence of such railway injuries. And the high voltage electrical lesions, so electrical burns related death is quite common in these kind of railway injuries. So in this section, basically, we dealt with how are we going to specifically deal with the autopsy if it is carried out for any road traffic accidents in specific, and what are the findings of such road traffic accidents at autopsy. That is discussed over here. That is the end to this section. Thank you for watching sqadia.com.